we do have some people already joining us today. So thank you everyone that joined us today for today's program. Today we have skin cancer prevention and skincare with Dr. Braghiroli. And Dr. Braghiroli, whenever you're ready, you may begin the presentation.
Okay, so good afternoon, everyone. I'm Naiara Braghiroli, dermatologist at Miami Cancer Institute. And today we're going to talk about a very important topic, that is skin cancer, how to diagnose in the early stage and also how to prevent. Okay. So May is the Skin Cancer Awareness Month. So it's one more opportunity to talk about this high prevalent type of cancer and how you can prevent them. Also is a Melanoma Awareness Month. It's one type of skin cancer, and you're going to talk about how to recognize them and also how you can prevent. So, and why this is so important? Because skin cancer is the #1 cause of cancer in the world. If you combine every other cancers together, still the number of skin cancer is higher than that if you add all the other cancers together. So more people are diagnosed with skin cancer each year in the US than all the other cancers combined. More than 9,000 people are diagnosed with skin cancer every single day, and more than 2 people die of the disease every hour. And at least 1 in 5 Americans will develop skin cancer at the age of 70. And most skin cancer, when they are detected early, they're easy to be treated with a single treatment modality, and also we're going to avoid a bad outcome. Okay, so you have 3 different types of skin cancers. Today I'm going to talk about all these 3 most common types and teach you how to recognize and when it appears on your skin. So the most common one is basal cell carcinoma. Is the most common cancer in humans. More than 1 million new cases of basal cell carcinoma are diagnosed each year in the US. So usually the basal cell, they can present different ways, can present as a red little bump on the skin, or sometimes even a little lesion on the skin that bleeds, that form crust, but never heal completely. Sometimes form a little crust and the crust fell and you think it's healing, but then the lesion comes back. And usually begins a very slow growing bump on the skin. Okay, after a minor trauma, it starts to bleed easily. So this is what is called basal cell carcinoma. As you see here, you have different ways to present. The basal cell can present in different ways. The first one is the classic nodule, when you have this bump in the skin, kind of pink with a pearly surface, and you can see some vessels, but can also be like skin color when you feel the skin feels different and more hard to touch. Can be just a red patch, or sometimes an ulcer, a lesion that doesn't heal, has this crust at the center and never heals. So this is the basal cell carcinoma. The second type is called squamous cell carcinoma, that accounts for about 20% of all skin cancer, but is more common in immunosuppressed people. The people has, for some reason, immunosuppression from a previous disease like HIV or cancers, but also secondary to some treatment that decrease the immune system. Post-transplant as well, especially kidney transplant. Its biologic behavior is much like basal cell carcinoma. It's very rare to spread to other organs of the body, but has a little higher chance than the basal cell carcinoma. So it's a little bit more aggressive than the basal cell carcinoma, but it's still, if diagnosed in the early stage, very curable with simple excision. So usually present a little different than basal cell. It's usually a red patch on the skin with some scaly areas that also does not heal. Sometimes have irregular borders and can also bleed easily. Can also present an open sore that does not go away for weeks. Can also present a raised growth with a rough and scaly surface, or sometimes just look like a wart. So this is a squamous cell carcinoma. The first one, it's an early stage squamous cell carcinoma. As you see here is a red bump with these scales at the center. The second type here, although looks like very aggressive and big, but this type here is called keratoconthoma, has a good behavior. Usually it's very curable with many non-invasive or minimally invasive treatment. You see this nodule with this crateriform, this indentation at the center that forms some crust. So that's the squamous cell carcinoma. And the third one, although is the most rare type of skin cancer, the melanoma, they are also the most aggressive. And this one, if it is not diagnosed in an early stage, can spread to other organs. So prevention is the key. We're going to talk about it, but also early detection, especially for melanoma. Okay, melanoma is the most aggressive type of skin cancer. Can happen in any type of skin, any skin tone. Even dark skin tone can also have a melanoma, especially on the areas of the body that is not exposed to the sun. So usually most of the skin cancer appears on the skin on areas they are chronically exposed to the sun, right? The face, the hands, the legs, the back, but the melanoma and people that has a dark skin tone can happen also on the palms, the soles, the genitalia, the mucosa inside the mouth. So it can happen any part of the body. That's why it's so important to the patients to do a self-skin check once a month regularly, but also see a dermatologist for their skin check. There are 4 different types of melanoma: the superficial spreading melanoma, lentigo malignant melanoma, acromelanoma, and nodular melanoma. Usually the nodular melanoma are more aggressive, but melanoma also can present in different ways. But usually you're going to talk about the ABCD of melanoma. It's a dark skin lesion with irregular borders, sometimes have multiple colors. It's a little bigger than the other lesions, but again, can present in different ways. You can also have a melanoma that is pink. We call amelanotic melanoma, and can be raised, can be flat, can also present in different ways. So talking about the ABCD of melanoma, A is for asymmetry. If you put a line in the middle of the lesion, you see that one part is different from the other side. So that's asymmetry. B is for border irregularity. So the border is not well defined. You see some indentation at the edges. C is for multiple colors. Usually the melanoma can have 2 or more colors, can be dark brown, light brown, black, pink, red, skin color as well. And D is for diameter, greater than 6 millimeters. Nowadays, with the technologies that you have available, you can find very small melanomas, you call baby melanomas. They are smaller than 5 millimeters, but usually it's big. So in the past, they used to be diagnosed when they are more than 6 millimeters. And also E is for involving any change in size and shape and symptoms such as itching or tenderness, surface bleeding, shades of color, and also structure in dermoscopy. And that's we find when you do the digital dermoscopy, when you do more monitoring. You're going to see some examples of that. So now talking about what is the risk factor for skin cancer, we know, knowing the risk factors, we can learn about prevention. So the majority of melanomas are caused by the sun. In the past, it was believed that only the UVB, the ultraviolet light type B, was the one that was responsible for skin cancer. But nowadays, you also know the UVA also can cause skin cancer and photoaging as well. On average, a person's risk for melanoma doubles if they had more than 5 sunburns in their life. 1 blistering sunburn in childhood or adolescence more than doubles a person's chance of developing a melanoma later in life. Regular daily use of sunscreen with a sun protector factor 15 or higher, sunscreen reduces the risk of developing a melanoma by 50%. Okay, so another important fact that I would like to discuss today is about the tanning bed. Tanning bed emit more radiation than the sun. The UV tanning device is classified by FDA as class 2, moderate to high risk for developing cancer. Indoor tanning device can emit ultraviolet radiation in amounts 10 to 15 times higher than the sun. So it's even stronger, 10 times stronger than the sun. More people develop skin cancer because of indoor tanning. They develop lung cancer because of smoking. Women who had ever tanned indoors are 6 times more likely to be diagnosed with melanoma in their early 20s. So talk about prevention. Number one thing, easy, is to avoid completely tanning bed. There are some countries like Brazil and Australia that is already banned completely tanning bed. Here in the US, you still see some places who use this device, but this should be completely avoided to prevent skin cancer. So we know the other risk factor is the sun, as we already talked, the ultraviolet light from the sun. So usually these type of lights, they are stronger during between 10 a.m. and 4 p.m. So we should avoid direct sun exposure during this time of the day, especially here in Miami, that you have a strong, we are close to the equator life. So you have a lot of UV reaching us directly during the whole long day. Using protecting clothing, long sleeve shirt, hat, it's very useful and convenient. You don't need to put the sunscreen under the clothes. It's very highly protective. So then you should apply the sunscreen on other part of the body that is not covered with the clothes. When you should look for shade. So every time your shadow is shorter than your height, it means that the sun is very strong and you should look for shade. That's a way also to enjoy outside, but also protecting your skin. Nowadays, you do have some laundry detergent that you can find easily online that also helps to add more protection to the fibers of the clothes. So it's very, very useful as well. And you do have some watches and the bracelets that help us to monitor the ultraviolet index. So any type, we're going to talk about it, but any type that the index is more than 3, it's a sign that the sun is very strong and you should look for shade. So the UV monitoring wristband and smartwatch has the indicator that can track the UV exposure. Many of these smart bracelets will alert you when the UV index is greater than 3, so moderate or higher, and then they're going to tell you that it had enough or too much exposure and you should protect yourself. There are some very cool bracelets that change color when the UV light is too intense. Talking now about sunscreen. Everybody should use sunscreen, especially here in Florida, daily, regardless if it is cloud outside or sunny day. We should use sunscreen. When you drive, the window of the car can block some UVB, but does not block UVA. So you should use sunscreen daily in a regular basis. So when you look for a sunscreen, there are 2 different types. They're the mineral sunscreen and the chemical sunscreen. Both are good and efficient protecting against skin cancer. So if you like the chemical better because you feel that it's spread easily and you feel better in your skin, it's okay. But usually we recommend a mineral sunscreen with zinc oxide or titanium dioxide because they last longer and they are more efficient. So when you buy your sunscreen, you look on the label, it has one of those ingredients, zinc oxide or titanium dioxide. The second thing that you should look when you choose a sunscreen is the SPF, that stands for sun protection factor. Usually we recommend 50 or higher because we in fact does not use the right amount of sunscreen. So I do recommend that you go higher on that number to kind of compensate this factor. The third thing that you should look when you buy your sunscreen, if it is saying they're broad spectrum, that means you're protecting against UVB, but also UVA, okay? So zinc oxide, titanium dioxide, SPF greater than 50. For the daily use, greater than 30, it's fine. Broad spectrum. And if you go do some outside sport and you are planning to sweat, or you go to the pool or to the beach, you should also look for sunscreen that says it has water resistant. While sunscreen cannot claim to be waterproof, they can be labeled water resistant for either 40 minutes or 80 minutes. 80 minutes is very water resistant. So yes, you can burn even if you are in the water. So actually it's double rich from direct sun exposure plus the reflection from the water. Also the snow, the same thing. So for the extended outdoor activity, use a water resistant broad spectrum sunscreen with SPF of 50 or higher and reapply every 90 minutes actually, or every time you swim or sweating. Very important. Reapplying also is extremely important. So talking about other ways to prevent, there are some good studies that show that the use of some vitamin B3 nicotinamide can also help to prevent precancers by 20%. And also another substance called polypodylactones that is found in some plants. But you should not take any medicine without consulting your doctor. So they're going to tell you if it is appropriate for you or not. So now talking about early detection. So you know how to prevent, but if you already has skin cancer, how you can find them in the early stage. The number one thing that I always tell my patients is to do a self-skin examination. Why? Because 75% of melanoma are detected by their patient themselves or by relatives. Okay, and the self-skin check has been shown to result in significantly lower melanoma-related mortality because of the early diagnosis. And all the dermatologic and cancer societies recommend monthly whole body self-skin check for high-risk population, such a patient that had melanoma in the past or atypical mold syndrome. So we already talked about the sign of skin cancer. When you do your self-skin check, you should look for growth that increase in size. They are pearly, transparent, brown, black, multiple colors. So this is an example of basal cell carcinoma. Mold that increase in size, they're raised, that change in color and texture. And also any spot or sore that itches, hurts, crust, scab, bleed, and any open sore that doesn't heal, that doesn't feel right, should be checked. So this is the A, B, C, D of melanoma that we already discussed today. A for asymmetry, B for border irregularity, multiple colors, D for diameter greater than 6 millimeters, and also involving any change in any previous molds. So early detection, we're going to talk about the total body examination and the dermoscopy, the total body mapping system that also helps to detect change in previous molds, confocal microscopy, and optical coherence tomography. Those are the most common technology to help your doctor to find the skin cancers in the early stage. So talk about dermoscopy. It's a handheld device that your doctor use when do your skin check to see some features that you cannot see with the naked eye. So usually a person, when they have a lot of moles, they have their signature. The moles have their signature. They have similar pattern. So when something deviates, some lesion has a pattern that deviate of this normal pattern, we call ugly duckling sign. It's something that raises a red flag for skin cancer. So this lesion, the doctor, you decide if it needs to be biopsied or monitored. So in patient that has high risk for melanoma with atypical mole syndrome, that means that lesions, moles of different size and shapes, multiple moles of different size and shape on the body, the digital follow-up is the most efficient strategy to detect early melanoma while minimizing unnecessary biopsy. So for patient that had melanoma in the past or has multiple moles, it's very recommended then to have what you call total body mapping. That means picture of the entire body. The way we can monitor those moles over time to any change on their moles. The way we can also avoid unnecessary biopsies. So you don't need to be removing every single lesion in the body if the lesion is not clearly a melanoma. Okay, if it has a melanoma, it has features of melanoma, we biopsy right away. But if the lesion has some atypical features that does not fit a diagnosis of melanoma, you can monitor the lesion over time. And if the lesion starts to change, this is a sign that this lesion is malignant. So only that being said, most of the melanoma happens on the normal skin. We call de novo melanoma. More than 80% of the melanoma happens on the normal skin. Only 20 to 30% of the melanoma are found in existing moles. So the way we can monitor your skin over time to see which mole are changing. Because if they are stable over time, you don't need to biopsy. And even most of the melanoma happens on the normal skin, does not come from previous mole. The fact that a person has a lot of moles or has this syndrome, atypical mole syndrome, they have increased risk of having a melanoma. Okay, so having more than 40 nevi in the body increase the risk of having a melanoma, and this patient should be seen by a dermatologist for their skin check regularly. So we do have a total body mapping machine here in NCI, Miami Cancer Institute. The one that you have here is called Vectra, is the one that performs a 3D imaging of the entire body with a very easy and friendly navigating system that helps the doctor to monitor from one part of the from the body to another part of the body very easily. So usually the patients stand at the center of the machine, as you see here in this picture, and there are 92 cameras that are connected to the machine. It takes the picture simultaneously in 10 seconds. Very convenient and very fast. After that, after those pictures, the patient see us for a complete skin check with a dermatoscope. So this image that you see here is what you see with the dermatoscope. And if there is any mole that needs to be monitored over time, we take picture with these special cameras, and you see here in different visit 1, visit 2, visit 3, and then you monitor to see if the lesion is changing. Okay. Another machine that you have here is called confocal microscopy. It's a non-invasive imaging that can help us to see inside the skin. We see feature that you see with pathology. We call this a virtual biopsy because there is no cut, and you see similar as you see with the pathology and the histology when the pathologist look on this light. So this is very useful for equivocal lesion that has not classic dermoscopy features of skin cancer, and also help us to map the margins for mole surgery, for radiation as well. So that's what you see with the confocal microscopy. This image here you call mosaic, and you see a lot of atypical cells around their hair follicles over here. That is a sign of melanoma on sun damaged skin. Another machine very useful, this one complements the confocal microscopy and helps to see how deep the lesion is, very useful for basal cell carcinoma. So all these three technologies for with the dermoscopy, they are non-invasive, does not cause any pain, and can help us to diagnose 99% of the skin cancers in an early stage. So if you do have any questions, I'll be happy to answer. This is my email. And thank you very much for your attention.
Thank you, Dr. Braghiroli, for your presentation. And yes, while you were presenting, we did receive a few questions. The first question we receive is, someone had a rash on their chest and they were told that they had cutaneous T-cell lymphoma. And if you can kind of mention what are the treatment options for cutaneous T-cell lymphoma.
Cutaneous T-cell lymphoma is not a common type of cancer, but you do see quite often here in Miami because we are close to the Caribbean, the Central America and South America, where this disease is more prevalent. Is a very indolent, that means that does not tend to cause aggressive disease, but the treatment depends on the stage. If it's a very early stage with just lesion on the skin, this can be treated with topical creams that your doctor is going to tell you what is the best option. But you can, most of the cases, you can treat with topical creams. Also, phototherapy, it's another option. You do have these treatment here in NCI. And when the disease is more advanced, when you have already the disease progressed to the bloodstream or the organs, they may need chemotherapy or radiation therapy. So the treatment depends on the stage. But most of the cases, it's a very indolent. That means that does not spread or gonna cause a problem generally. The patient usually will say that the patient will die with the disease, but not from the disease.
Thank you, Dr. Braghiroli. And the next question is, how can you get enough vitamin D from the sun without increasing your chance of getting skin cancer?
Yeah, that's a very good question. So usually the amount of sun exposure that you have in your daily activity, when you drive, when you walk from your car to your grocery, that's enough already to produce vitamin D. If you're indeed deficient in vitamin D, then you should have supplement. Your doctor is going to recommend you the dose that you need to take of vitamin D to supplement. So if you're deficient of vitamin D, there is not enough sun that you can get that is going to cause this level to the normal. So you increase your risk of skin cancer to compensate that, and doesn't worth it. So the daily sun exposure that you have should be enough. But if you are deficient, that means in less than 30, the level, your doctor is going to tell you how much vitamin D supplement you should take.